Excited to be in your office here in Nashville, Tennessee.
Welcome.
I need my cowboy hat.
This is cowboy country. No, this is actually the hub of where this stuff happens in the world. Music, entertainment, and you're here.
Oh, that's great. And just coming back from Dubai, I mean, I'm impressed that I can even get a hold of you for 5 minutes, and it's your first Facebook Live. That's even more exciting.
First time on this platform, so I'm excited to do that. Yeah, I'm just back from the Dazzle meeting in Dubai, which is an international derm surgery meeting, and we had a wonderful meeting, 600 people from 40 countries, and did teaching in every aspect of derm surgery, so it was a lot of fun.
Well, what's the newest trend? What's the newest thing happening that people might want to hear about that weren't able to go to Dubai?
Well, again, different fields have different focuses, so I'll just give you some of the highlights. So we actually do hair transplants over there. So talking about the new single unit, what we call FUEs, follicular units, and where we take individual hairs either through machines like Neograph or Restoration Robotics, or two of the companies, but we're using them, and so we had sessions on that. We had liposuction from the world's greatest liposuction doctors, where we actually talked about the newest thing is getting back more into fat transplants and fat harvesting the proper way, and how do you inject back. Then on the laser and energy side, obviously, microneedling with or without radiofrequency is a huge topic, and so we did that. And then we think of Botox and the injectable toxins like Xeomin and Dysport one way, but the world thinks of it differently. And so the concept of a term called mesobotox is really big around the world.
Now, meso is, I think, of mesotherapy, right, with 100 little injections.
Well, so it's 100 little injections on your face, but the work that's being done in Asia, not only do we take all your pores and shrink them to almost nothing, we rejuvenate the skin, and so those rooms, when they talked about how they do this, were just packed. Fillers, not only the good of fillers, but the complications are really playing a major role in today's world. Vascular injury and so forth. So again, we had experts in the world on what we need to be aware of and what we need to look at. And so, yeah, the conference focused on tons of things, and you sort of picked your track of where you want to go. So Dazzle was in Dubai. Next year, we're going to take it to Shanghai and do the same kind of thing. So, yeah, it's just fun.
And then you have your meeting coming up, which is now in May this year.
Right, so Music City Scale, which is the meeting we do here with, I do with Dr. Brian Beisman. We're in year 12, and so we're pretty established. And because of some scheduling issues with the American Academy of Dermatology and others, we decided to go to May this year, which is actually interesting. There is no other major dermatology meeting or aesthetic meeting in May.
That's great.
So that's going to work for us. The weather here is perfect in Nashville, so we want everybody to come. But it's going to be, we have an incredible faculty. So almost 30 of the country's leading, whether it's fillers, toxins, lasers, other energy-based systems, practice management, which you'll do, and other things. But we have the best of the best coming to this meeting. And so, and actually this year we're going to be in what's called the Music City Center, which is our brand new convention center, and one of the beautiful ballrooms, instead of in an ugly looking space that you sometimes see in convention centers. This is spectacular. And so we'll have guests stay at the Omni, which is our convention hotel. But last night I actually went to the opening of the Westin Hotel downtown, and so we're going to have both hotels. So right next to each other, right next to the convention center, and we'll be in between.
How many people are you expecting to attend? It's so exciting.
So we average about 400 to 500 people every year, and sort of the goal this year is about 800.
Wow.
So we're going to try to double everything this year. So
that's exciting. I just found the book sitting in your office, how you were featured on the cover of Radiant Life magazine, and I'm sure we're going to feature you again. We're actually talking about it doing a skin derm one, so we'll have to get you on the cover of that.
And so this is great because again, it focused on us and why we do the meeting, and the concept here is that it's a nonprofit, the Laser Society, even though it's called Music City Scale, it's for a laser society, and it's to promote education and patient safety. So everything that we do from this actually goes to community-based lobbying efforts in this part of the country that we use to work with our sister societies like the American Academy of Dermatology and the American Society of Derm Surgery, but to do patient safety. And so our goal here is to teach, but at the same time make sure legislations are set up, and that we can help sort of shape what this market looks like as far as who can do what, how they can do it, and what level of education they need to be, and what kind of supervision people need. So there's a reason behind the madness. So we put on this meeting to teach, but at the same time we're putting this meeting on to raise funds for the efforts to keep patient safety at the forefront.
No, which is great. I mean, Tennessee is definitely a leading state, and most people don't look at Tennessee.
So we've actually passed several laws here in the state of Tennessee about truth in advertising, patient safety, registries for med spas, and not that we're trying to put any of them out of business. We want to make sure that they are doing things correctly and that they have the right supervision. So, when we hear that it takes, 5 years or 6 years for somebody to do something, for the most part here, we can do it fairly quickly. We work with the legislature. We actually teach with them. We actually work with the bodies that need to be shown how we do this. And once we've done that, we've had pretty good success around here. And again, we're not trying to put people out of business. We're just trying to educate. And so they get it and it works.
No, and I think that that's important. I mean, we need a lot of education. There's no question. There's too many people just picking up a needle or picking up a handpiece, as you and I have had discussions about, and doing things way off label, and and then it's causing problems.
And without the right supervision, you can get in trouble. So we want to make sure that if again, we'll use Tennessee as the example. If we're in Nashville, we want to make sure that if somebody's working in a spa environment, that their supervisor's in Nashville, not in California. Right. And so that happens around the country.
What is the state law here in Tennessee?
The provider has to be within a certain geographic area.
So a phone call away or within a certain amount of miles?
Yeah.
Okay.
And we always have to be available.
And does it have to be a derm or a plastic, or it can be any physician?
So the burden's on the physician. It can be anybody, but the burden is on the fact that if there's an issue and they're not trained on the device or the procedure, then they're going to get themselves in trouble. So, the physician takes all the responsibility. And so just putting your name out there and, if you don't know what you're talking about or the device and what it can do to people, you can get yourself in trouble. So we, again, try to preach this educational pattern,
and I think that's great. I mean, I'm an educator by trade, so I'm a believer in that. I have my book out and I'm all about educating, and we're on the 5th edition. I keep updating and educating and training on the marketing and business end, and it's great to see that you're doing what you're doing.
We were talking today with another one of our friends in the business, and we were saying, at this point in our careers, we could sort of sit back and do nothing. Yet we're working harder on the teaching parts, and we're working harder on the educational components of that, because it's important. And so what I'm looking for in most of my meetings that I do is actually, and I run 3, so
I know how you do it.
I'm always looking for that next generation. Who can we mentor? Who can we bring up that are going to take over? Because I had mentors. Now I'm sort of in that seat where I'm running things, and now we need to find a whole new generation. And so that's been a big focus of me personally. And there are some wonderful new docs out there around the country, around the world. And again, it's just working with them that they're comfortable in front of audiences, they're comfortable writing papers, doing the clinical research, things that I've been doing now for 30 years, which is hard to believe, but it's 30 years now. And, we want to make sure that we leave this group in charge, that we've done everything we're supposed to do for the next group. So it's working fine.
When you think about an exit strategy, and it wasn't what I was even going to talk to you about today, it could be 10 years, 15 years, 20 years. I know your wife won't let you stop working. That I know. But, one of those days, so you're going to bring in other partners. There has to be a plan in place.
So the plan is, in an ideal world, we're going to have venture capital come in. Dermatology is a hot topic right now. We'll work with either a company, create our own company. All those things are in discussions now. I'm not going anywhere.
No, you just love it here. But how do you engage your staff? You have this, I went on your website today. I'm so impressed that it must have been 35, 40 people on your staff. I don't even know how many there are. But how do you engage them all in the whole selling process, from dermatology to your laser center, to your Medi Spa, to the retail products? There's a lot going on, and you're a really good leader.
What we try to do is, again, we have lots of intergroup meetings, and we try to make sure that they understand that dermatology, is skincare. It's not only just taking a mole or skin cancer off. It's what are you going to do later? It's wrinkles and lines. So yeah, we spend a lot of time working between our laser center and our medical spa with our providers to make sure they understand how they go like this, and dermatology goes like this now. So not only are we medical, but we're cosmetic, and you have to understand how they all work. So anybody that has a cosmetic procedure, a laser or something, has to be on a skincare routine. Some people don't want to get a laser procedure, they start on a skincare routine. And then as they learn more about skincare and what it does, then we move them into the laser world. So again, there's ways to do this. I have a huge acne practice. It's also become a very huge acne laser practice. And people around here know that that's something that we spend a lot of time with. So we use a lot of devices that help us. There's a new one, the Aerolase Neo. Yeah, it's painless. And so I don't talk devices, but that one's painless. And it's changed how we think about acne. So we keep the prices reasonable. Friends tell their friends. Again, a concept I used 30 years ago in my marketing. If I'm taking care of, Johnny and Susie's acne and their kids, and I'm not hurting them, and I'm actually getting them better quickly, and mom is bringing them here, all of a sudden Johnny and Susie aren't coming here anymore. Mom is. And mom tells her girlfriends, and so forth. Then mom drags dad in because he's got a mole. And then all of a sudden the whole family's here. And, again, 30 years later, I'm seeing mom, daughter, child. So now I'm at 3 generations.
Right, which is great.
Which is really scary.
But is there one thing that you would have done differently with the knowledge that you have today in business, now that you see things from a whole other perspective, that maybe you would have done differently?
I always tell people we make mistakes every other day. Try not to make the same mistake twice, and that's the biggest ticket of not doing things whatever. I have a great team, and so my team, from my marketing team to my HR team to the person that runs my life here, that's what the team's for. So would I do anything different? No, I love what I do here.
And how do you? You're a leader. And I always say to the practices, whether they're starting out or they're having trouble with staffing, everything starts at the top. So you're a really good leader. You talk about the meetings. You talk about taking care of everybody.
We meet all the time. I meet with my administrators every day. I meet with my laser team once a month. I meet with my spa team once a month. I meet with everybody on a regular basis all the time.
Which is, I think, the key point. Keep connected.
And so you're in my office now, and that door is shut once a month for 5 minutes. If it's that much, I never keep people from coming in here. So, I don't want to get involved in all the minutia of running an office anymore. But I'm here, and I listen, and I, make the decisions based on what I think are appropriate at this time.
And so you have managers in each department that then they report back to you.
But I meet with the whole team on a regular basis all the time.
Which is great. How do you compensate the staff? Is it a team effort, or is it an individual effort?
So compensation is different for different things. So I think, we like to think we pay very competitively. We bonus people, at different times of the year based on certain things. We give raises when appropriate. We think we're pretty in the ballpark as far as how we do it. So it's interesting. I like my, skincare products that we sell. There's a commission based on that. But there's not a commission based on how much Botox we use or how much Restylane we use or whatever. That we sort of sit down and decide, hey, we've had an incredible whatever, and then we take care of people appropriately. And so again, it's sort of, I've tried everything over the years, and that's what works for us.
Right. What works for you, it's obviously working, because every year that I come to see you, the same staff is here. And everybody, as we were talking about, is so friendly and so nice. And
my senior staff has been here a long time.
Is there a cosmetic questionnaire that you would give to, let's say, your derm patients to fill out so you know if you should lead in the direction of laser or med spa?
So I think most practices tell you you need to do that, and I probably don't do it enough here.
Okay.
We see so many people, and so I'm focused on, if you ask what my biggest criticism when you ask patients about me, I don't spend enough time. Okay? I just don't have that time. So we're looking at how do we work within the system of what I have here. So if you call up and have a cosmetic thing, we obviously put you in one track. But when you come and see us, we'll ask you what you're here for, and we try to cover everything, within reason. But we don't have. I'm not a believer in you come to me for acne and all of a sudden I'm talking Botox.
Right.
It's not what I do.
Okay.
And so I don't want people to focus on that they have to do cosmetics.
Okay.
We are a cosmetically based practice, but yet I see more medical derm than anything else. But the volume that we see in the overall office is cosmetically more than most practices.
All right. How many patients you see a day? I can't even imagine.
This place puts between our every facet of this, we put 200, 250, 300 people through a day.
Which is amazing.
Yeah, except I also go to China on a regular basis, and I was just at a hospital with my derms over there, and they see 2,500 patients a day, every day, 7 days a week. And I'm like, are you out of your minds? But that's what they do.
They don't sleep.
No, they work all day. So.
What's the biggest change that you've seen in your practice over, let's say, the last 5 years?
So the biggest change, I guess, now that we're going on is prescription drugs are out of control. It's harder to get them for my patients. It's harder, for them to afford what we do as far as the medical side. On the cosmetic side, we keep our fees at a certain level because you're paying for what I do. You're paying for my experience, what I teach my staff, how we do it. So the whole thing there. And so, the biggest concern.
Insurance too.
We take everything.
Pay,
we take everything. So, obviously, cosmetics is cosmetic and it's all cash based. But the insurance part it's part of medicine. So again, you don't go into doing what we do because it's only about the money part of it, and that's we're lucky because we have a cash based business. Right. But the insurance, we're here to take care of our patients. And, I actually get excited when I see a rash that I don't know what it is, which is kind of work, but that's the reality. And again, if I walk into a room and you have a rash and I don't know what it is in 2 seconds, I can spend 2 hours with you and I'm not going to know what it is. So again, 30 years of experience of looking at the skin. If I can't tell instantly, it doesn't matter what I do. So we like to think that we are very patient focused and taking care, making sure we use the best medicines within reason of insurance companies. On the cosmetic side, we have 45 lasers. We are the cosmetic people in this part of the country because this is what we do.
Which is great. So in the next 5 years, to wrap up, what do you see ahead as the changes happening?
On the medical side, I think we're going to get better. I think the prices are going to get to where we can actually afford to do what we're doing. On the cosmetic side, the laser business is improving. Where we had hair removal, we had a single wavelength laser. Now we're going to have multiple wavelength lasers, and I'm working with all these companies on how we do that. Picosecond lasers have changed the focus. So, we have one pico system in here. We're going to add a second pico system in here. And again, the micro needling are huge. And then on the skincare side, however you like to use the term, antioxidants, growth factors, they're going to change how we think about people and what we do for patients. So there's lots of things coming. How different they'll be, we'll see as it comes on.
Well, if anybody has any questions for you and they want to ask a question or ask a question of somebody that works for you, how would they get in touch with you?
So you can go to our website, www.goldskincare.com, and there is a place on there to ask questions and we can get back to them. Our office phone number is 615-383-2400. Again, we're around, we're here. This is what we do.
And on Facebook Live, we usually take questions and answers, but since we didn't have time, and I'm so glad that I got you to sit still for 5 minutes, I guess because he's tired off the plane from Dubai, but it was really great, as always, and I really appreciate your time today, and I look forward to seeing you at the scale meeting, if not before.
We'll be here.
Okay,
right,
sounds good. Thank you.
Appreciate it.